What I would say is that there is a fewer school of pharmacy when you copy it to the number of school of other health practitioners, nurses and doctors, and medical doctors. Despite the needs, there is a gap in the manpower development strategy. For me, the main reason, the main inequities are access to means for education, which means what? There is inequities by the economic, social inequities. There are inequities in technologies, the use of technology, the use of digital. Gender is coming after, because when you see what Africa has done for the education of female, I went to Nigeria, to Ghana, to Cameroon, to Egypt. I've seen many females educated, which means that the gender issue is not the first one in our continent, in our region. We have problems of means, we have lack of means, lack of technology, lack of digitalization, lack of funds to develop education in Africa.
I will just add to that by saying that yes, indeed, the main inequities in pharmaceutical education lie with difficulty in accessing resources because of the low socioeconomic status of the entire continent. Also, the lack of resources, apart from digital and technology, also the lack of, there are inadequate pharmacy schools across the region. Some countries have much more than some countries don't even have any at all. Also a relative lack of qualified teachers to teach in these various faculties of pharmacy or schools of pharmacy, as the case may be. So that is where the main inequities lie: resources, access, and ability to learn in a comfortable environment.
I think policymakers often think that other healthcare practitioners are important. Then when it's come to pharmacy, the means that are given for education of pharmacists are very less. This is something you have in many countries. You will have many medical doctor school well equipped. You will not have the same in pharmacy. And the culture also, because I said at the beginning that gender is not really the first one, but in some countries you have some obstacles for the education of young girls and young female. This is a cultural problem, but it is not so high when you compare to the average number of female coming from the education of pharmacists. When you go to Nigeria, you are very happy to see girls, to see ladies. In Ghana, it is the same thing. The majority of the pharmacists in that country, students, are ladies. This is something that we should address to all the world, that we are taking care of females in the education of pharmacists, of future pharmacists in Africa. It's really a success. Thank you.
In addition, highlighting the policy issues that drive inequity, the laws are not favorable to pharmacy education generally across the continent, maybe because there is a relative lack of pharmacists in these various political positions to ensure that the laws are more favorable. It could also be because of a relative gang up of other healthcare providers against against pharmacy, and then the general lower access to funds that the various countries in Africa have also comes to bear, and so opportunity cost comes in which one which one they think is more important in whatever indices they use to determine importance. And most often, more often than not, pharmacy education seems to lose out of that. So these are some of the drivers: policies not favorable, other healthcare providers not being open-minded enough to ensure that all healthcare providers are included in the various aspects of healthcare delivery across the continent. And then the low middle income country that we are, that means there's a general low availability of funds anyway for various other things. And of course, corruption is a driver of everything good. Corruption across the continent has been identified as one of the main issues affecting development generally. Thank you very much.
Resources, having resources to promote education, this is for me the main inequity. The resources to build, to have infrastructure, to have labs, to have libraries, to have teachers well paid, well supported. If you don't have lecturers that are well paid, how do you want them to do research? This is, for me, the remuneration of lecturers, of researchers, is something important. The most important for me is that point of means, of having means to educate our young girls and brothers and sisters of the continent. I think when you see this, look at the continent, when you look at South Africa, Egypt, when you see the ranking of universities, you will see that those countries are the main in education globally, because of the investment that the government have put in the construction for the building, for the education of people. The other countries are trying to get new schools. In my country, imagine we have 5 universities working, which are training pharmacists, 1 private. When you see the gaps between the student coming from the school, you will be very surprised that they have not got all their units of values for schools. They have not got all the materials. We should not have this kind of situation in the gaps or in the situation in the continent. We should not have it, but we are working on it, and Arinola is the best person to talk about this, reducing the gaps between the universities, the schools of pharmacy in the continent.
Okay, thank you. These inequities that are listed: gender, racial, ethnicity, and religious inequities, resources-related inequities, and then education-related inequities. As you have heard since we've started this interview, resources-related and education-related inequities are the highest forms of inequities in pharmaceutical education in Africa, and it includes lack of funds to ensure that all that is needed for the practicals, for clinical clerkships, for the various rotations that the students have to do, external postings, everything is available. Infrastructure, and infrastructure I'm going to include there, including digital infrastructure. COVID hit and a lot of schools could not continue learning because students were sent home and there was difficulty in access to even the schools that were able to pivot to digital learning, online learning. A lot of the students didn't have access from where they were living to even join the classes online, but there has been some innovations in that we will share in the success stories. So education related inequities, including access, learning and quality in pharmaceutical education, are issues in Africa. Gender inequities are not common for us because there has been a general push to ensure that the girl child is well educated across the continent. And in fact, now I keep telling the male pharmacists that they are the endangered species right now because there are more female pharmacists coming out of the various faculties of pharmacy across the continent. So gender issues are not a big issue. The way gender plays in is when it comes to, for instance, students are at home and they have to do online learning. There is especially in most of Africa, there is the focus on the girl child being involved in house chores, being involved in cooking and all that. And so when students are at home, the girl child is relatively busier than the boy child. And so the time that the girl child has to spend online may be lower quality time or even lower available time than the boy child would spend. Racial, ethnicity and religious inequities, I'm not sure that plays into the issues on any serious scale. I was telling somebody we are all Africans, so we can't be racial against ourselves. But of course we do know that there is still some divide between the north and the south, between those that have better access to education versus those that don't. I know something that we do in Nigeria, which some of us have been speaking against, is the quota system. And the whole purpose of this quota system is to ensure that every region across Nigeria is represented in schools, whether at the secondary schooling or the tertiary schooling level, so that differential entry points are given to enable representation of different students from across the country. So that has helped in closing the racial or ethnic divide as much as it could. So these are the issues that are serious. The very serious ones are resources and education related inequities. Thank you very much. President, can you hear me?
Yes.
Oh.
Yes.
Oh, okay, sorry. I thought you were talking to me. Okay, I was going to mention about the strike.
Yes, I can hear you.
Nigeria, which is an issue causing inequity in education in Nigeria. Because when COVID hit initially, schools in Nigeria were on strike. Public education, tertiary institutions were on strike. But after COVID restrictions were lifted, the private universities were able to pivot relatively quickly to the digital platform, while the public schools were still on strike. So that caused some level of inequity. So students that were in public schools were at home for well over 8 to 10 months at that instance. And right now, there's another strike ongoing, and public schools are shut down again, and the private schools are in school. So there's some kind of inequity in that, because for whatever reasons, those of us that our children are in public schools, they're at home. Some people have taken their children out of public school and put them in those private schools so that they can finish their education. Some people can, some people cannot, some people don't want to. But that has given a different level of inequity to the issues that are normally encountered by other groups. And then sometimes again, it's a strike by the healthcare workers, not even the educators, and that also affects us as pharmacy education. So that's an important point to add.
Yes, I wanted to address something about the gender inequities, because I went to a graduation in the School of Pharmacy, and I discovered that many girls, many females were pregnant. It is something that you discover in many universities. Young girls getting pregnant, having to face maternity challenges and childcare. This is something that we have to look at, and so that females can do their school, they can go to school without any obstacle related to their nature of being women, giving life. The time to go to school is there. The time to become a mother is also there. It's difficult to join the both when you are in school. It is something that we have to think about it in our school, in our way of educating our young female.
Permit me to add to that. Some ladies plan to finish school. In all fairness to them, they plan to finish school before getting married and starting a family. But when strike goes on for too long and they cannot stop the natural conclusion of their family dreams, you find out that, strike has been on for 1 year, 2 years. You had thought you would finish school in a particular year, but you are still a student because of strike. And then you find that they go ahead with their life plans and get married, and then they have to do that combination of family life and school life. It's very difficult. It's a big challenge, but it's a common scenario because of where we find ourselves. At least I can speak for Nigeria. A lot of females that get married is because they got tired of waiting because of strike and decided to just go ahead anyway. Thank you. Okay, sharing stories, real life situations on addressing inequities in education. We've talked about the issue of the girl child and the fact that we have quite a number of female students in pharmacy schools now. In many administrative positions in pharmacy across the continent, we have many ladies that are responsible. They are the responsible head of those units or those departments. So that's a success story as far as I'm concerned. That the gender issue is not overwhelming us in Africa. I think it's a good thing. There's another story I'd like to share. In listening to some of the digital events, there was a digital event on education that was done in FIP, and I realized that some countries had actually done some innovative approaches to addressing education right here in Africa. There was the story of Namibia, where they provided internet dongles when their students, because of COVID, they had to send students home so that they could continue learning. They gave all their students internet dongles so that they could have access to education online from their houses. Of course, there were quite a number of students that were able to use those dongles, but unfortunately, there were some that still could not use it because their living environments are places where there is no internet service at all. But that the institution could actually provide internet dongles for the students, I think was a very, very good thing. There was also another event where students in Ghana shared how for those that were living in places where they could not have access to internet, their institutions used the postal service to communicate to them assignments, case presentations that they needed to respond to. So they used the postal service close to those students' homes to get the assignments to them. The students will do their assignments and then send it back through the postal service back to the school. So there are some means of trying to cover up these inequities. There were some institutions and some countries that were able to work with their maybe federal or state or local governments, I don't know which, to provide some resources that helped their students to continue to learn. And these are things that can be shared, that can be emulated by other countries. We also know this zip line story. While that is not particularly for education, but it can be utilized in providing access to education for people in rural areas too, where drones are used to supply healthcare materials to those in resource limited environments. And Zipline is covering more of Africa even as we speak. So there have been some good success stories across the continent. Here in Nigeria, after the strike was called off and we're still not able to resume school, some institutions, the public institutions too, eventually needed to pivot to online learning. And while the strike was on, for some of the schools, the IT units of the institutions were learning how to use the Zoom, what to do with it, how to deploy it. And so this became very handy. By the time school resumed, they did a series of trainings for the lecturers and the students. There were a lot of manuals on what to do, how to go about accessing the internet, uploading your lecture, recording your lecture and all that. And these are things that are still available for us to use, to continue to use now. We know that we're not likely to come to the end of COVID in a short while as we had hoped initially, but COVID has taught us that there is life and learning even where we cannot physically gather, and that's the success story that I have to share.
What I wanted to add is my pride as president of the African Pharmaceutical Forum. When I go to Nigeria and Ghana, when I see ladies association of ladies pharmacists working to promote ladies in pharmacy with results, because Arinona has highlighted that the good position now taken by ladies in the organization of the pharmacy in their countries. When you see in Nigeria, FDA, it is a woman. In Ghana also. These are positive points that will serve like examples for the other generations. I think we are on the good way for the development of the continent with the level of ladies educated in the continent. And ladies becomes their mothers, they educate their children also better than men. And this is something that we have to continue working on. The second thing is technology. I am sure that we will go to digital like we went to mobile money. When you see the success of mobile money all over the continent, you see that Africans need and know how to use technology. The other problem will be how to provide renewable energy everywhere so that the digital can work every time. These are points that I wanted just to add after Arinola. I think one of the first recommendation will be addressed to the government. Government should invest more in the education of pharmacy. It's also important to have private sector working for education of pharmacy, encouraging private sector to invest in education. I've seen a good example of collaboration between a university and pharmaceutical industry in Africa, in Algeria. Last time when I went to Senegal, they presented something very interesting because you see how a company invests in a university with results in the training of pharmacists, in the equipment of laboratories, in the infrastructure, with good results at the end, good impact. This is something that we have to look at and encourage. We need collaboration between our governments, between our universities. We are already working on it. We should encourage this association that we are putting in place. We should also will need support from foundation, from other organizations for our students, as scholarships, as donation. We need to have an harmonized system of education in Africa. We need to work together to go through this important purpose issue and have expect good results in the future. I think for me, it is what I had as recommendation. We have talked about technology, development of technology. It is fundamental. We have talked also about the other inequities, but for me, these are the main points that I had in my head and in my head to address to you.
My recommendations to FIP are for to support the countries and to work with them and mobilize them towards prioritizing pharmaceutical education. And this goes for all the countries across the region. Even though there are differences in the numbers of schools of pharmacy across the region, each of these schools still needs a lot of support in terms of resources, in terms of increasing staffing, especially the public hospitals. So if FIP puts in their advocacy to these countries to prioritize pharmaceutical education, it will go a long way in supporting the requests from the schools themselves. More staff are needed, more pharmacists need to be employed because more pharmacists need to be trained, more schools of pharmacy need to be established, and in those countries where the schools of pharmacy are departments within the College of Health Sciences or the College of Medicine, they should be mobilized and encouraged to set up independent faculties of pharmacy or independent schools of pharmacy or autonomous schools of pharmacy, so that they can, as a faculty or a school, go directly to the university administration to have their needs of staffing, resources, laboratory requirements, and even relationships with the hospitals and the private pharmacies around they can go with their independent requirements to ask for this. In addition, there's a need for investment in more digital tools for appropriate deployment in teaching and learning, whether it's at the undergraduate or even the postgraduate level. And this would further improve the capacity of teaching when any other pandemic or any other issue may happen. So addressing my recommendations to FIP, and then also the same goes to individuals who have the resources, for instance, to set up private faculties of pharmacy. We know that resources required to set up a school of pharmacy is a bit more intensive than what may be required to set up a college of medicine, for instance.